And welcome to the Dr. Bob Show. Did you know that your heart may be responsible for symptoms such as, I feel like I'm going to pass out, I've got palpitations, I'm nervous, my heart is racing away, my heart's too slow and I've got fatigue, I don't feel good. Is it my blood pressure? Maybe your heart. Is it my thyroid? Maybe your heart. Is it my adrenal glands? It may be your heart. We'll be spending most of this show talking about the heart and how it can be responsible for irregular rhythms and maybe even passing out. A lot of information for you. My guest is Dr. Malcolm Foster. Dr. Foster is a board-certified cardiologist, and he'll be answering our questions. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about cough. Could it really be good for you, or is it always bad? And the dangers of too many NSAIDs, ibuprofen-like medications. A lot of great information for you. We're talking with Dr. Malcolm Foster, board-certified cardiologist, and we're going to be talking about the heart and how it can be responsible for all sorts of symptoms: dizziness, fatigue, feeling like you're going to pass out, fluttering, fast heart rate, slow, almost everything. And he'll be answering our questions. Malcolm, welcome to the Dr. Bob Show.
Thanks, Dr. Bob.
When you think of the heart, why does the heart beat?
Well, the heart has electrical tissue, what we call pacemaker cells. So the upper chambers of the heart and the lower chambers of the heart, and the heart beats coordinated, upper, lower.
So the upper chambers, do we have a name for those?
That's called the SA node.
The upper chambers is
The upper
the atrium?
chamber, the atria, yes.
And the lower chamber is the ventricles.
Yes.
And so the SA node that you mentioned there,
yes.
Is it one of those electrical impulse providers?
That's right. It's called a pacemaker cell.
And what does it pacemake? What does it do?
So that is for people that are in normal rhythm, that sets the resting heart rate. And then as we respond to exercise and things like that, it increases the heart rate.
So it knows what to do. It's pretty smart?
In that sense, yes.
Okay. Now, is it always doing a perfect job, or are there things that make it have problems?
So the SA node can have dysfunction. So we call it a sick sinus syndrome.
So it's not sinuses.
Not these.
It's a sick SA node in the upper chamber in the right part of the heart.
That's right.
Wow, that's a lot of words.
But in that case, the heart may beat too slowly. Now that can happen for unclear reasons. Just when a person gets older, we see that more commonly. It can also happen, for example, as a side effect of medications.
So when you say slower heartbeat, what rates are you talking about? What are the normal rates?
Well, a normal heart rate is typically between 60 and 100. Now it is possible for a person who is very physically fit that their resting heart rate can be slower. So a good fit person might have a slow resting heart rate, not a problem. But in general, for adults, 60 to 100. And then when somebody has a sick sinus, that heart rate tends to slow down much slower, down into the 40s, say.
So if somebody has a rate of 40 because of a sick sinus syndrome or a sick SA node, can that person function with a heartbeat of 40 beats a minute?
They can function, but not at a normal level.
So their symptoms would be?
They're going to have fatigue, their exercise intolerance. They can't do their normal activities. They may feel lightheaded, like they're going to pass out.
Wow. That sick sinus, that sick SA node, does it ever get sick enough where it just doesn't put out any impulses?
Well, it can, and then the lower chambers that have pacemaker cells as well can have what we call escape beats or an escape rhythm, and that will bring the heart along at a heart rate of about 30.
But it's a protective mechanism. If the upper part goes bad and just stops, then you've got other areas that will take over to protect the person from dying.
Yes, but you'll be dragging. With a heart rate of 30, you'll be dragging.
I think you'd be dragging big time. With a heart rate of 30, the reason you're dragging is because the heart just doesn't have enough time to beat out enough blood to the person, so
Correct.
they feel poorly.
Yes, sir.
Tell me about why it makes them feel like they're going to pass out.
Well, you need to maintain cardiac output or blood flow. So you're maintaining blood flow to your vital organs, most importantly your brain, but all the rest of your vital organs. So without an adequate heart rate and an adequate blood pressure, again, you may feel like you're going to faint or pass out. You'll certainly be fatigued.
Does anybody ever pass out because their heart's not beating fast enough?
They do. They do. And in fact, the heart can also pause. It can pause for a few seconds. It can pause for 10 or 20 seconds.
Wow.
And they faint.
So how long does it take a normal person, 60 years of age, with a pause? How many seconds? About 10 or 15 before they...
It could actually be even fewer. So just several seconds of a pause might be enough to faint.
So if somebody is having problems, I feel like I'm passing out, and a couple times I fell out on the floor, you have to think of this as one of the possibilities.
Correct.
And there's lots of other possibilities that can go on.
Yes.
So that could be a sick sinus that's doing that, meaning a sick sinus node. How about the other areas that took over the pacemakers on the lower chambers?
Right, so in the lower chamber of the heart is called the AV node, and then that distributes the electrical signals to the heart muscle, the right and left ventricle. The AV node and the ventricular conduction tissue, the electrical tissue, can also have arrhythmias.
So how does the patient know? How does the doctor know? I mean, he's sitting there listening to the patient, their heart rate's a little slow. What keys the doctor to know, hey, this may be your heart that's causing you to pass out?
Well, taking a good history from a physician is very critical, and examining the patient, and then doing an electrocardiogram, an EKG.
So what do you ask the patient for? What symptoms are you looking for?
Well, we're asking, first of all, have you taken your pulse? For example, people have a blood pressure machine that also gives you a pulse reading. So it's very helpful to know if they've taken their pulse or if somebody has taken their pulse. But their symptoms are fatigue, they can't do their normal activities, they might be lightheaded, those type of symptoms.
So can you teach people to take their own pulse?
Certainly.
Where is the pulse that they can take?
So on the wrist, on the thumb side, you can feel the pulse. That's called the radial artery. You can also feel the pulse here on the carotid artery. Be gentle, but the radial artery and the carotid artery with your fingertips.
So you can feel the heartbeat, and you count it for 15 seconds, multiply by 4. That
would do it.
Or 30 seconds, multiply by 2.
Right.
That's about all the math that I know there. So electrocardiogram. What is the electrocardiogram going to tell you?
It actually gives us quite a lot of information. So it gives us information about the heart rhythm, whether the rhythm is normal or an abnormal heart rhythm, the heart rate, the heart rhythm, and lots of other information about the heart.
So if you've got a sick sinus, it's not really working good, could the electrocardiogram be fairly normal for a period of time and you don't catch the sick period?
True, that's true. So between episodes, the electrocardiogram might look normal.
So you've got to figure out a way where you can know how the heart beats all the time. Is that available?
It is available.
And that's what we're going to be talking about when we come back. What's available to know if your heart is really beating properly for a 24-hour period, 12-hour period, 3 days, a month? A lot of information. You're going to really be interested in this. We're talking with Dr. Malcolm Foster, board-certified cardiologist. We're talking about a sick sinus syndrome. Not sinuses in the head. There's a sinus node in the heart, in the upper chamber, that tells the heart how fast to beat. If that's not working right, bad things can happen. That can cause fatigue, malaise, feel like you're going to pass out, rapid heart rate, slow heart rate, a lot of different things, and you have to be aware that it can happen. Tell me about, let's drop back to the SA node again. can it fire off a fast heart rate or slow then fast or other rhythm problems?
Yes, we call it tachybrady syndrome or slow fast syndrome.
Tachy's fast,
Tachy-
Brady's slow.
That's right. So when
Gotcha.
the sinus node is sick and it's not functioning properly, that's also a setup for the atria to go out of rhythm, and that's called atrial fibrillation.
So what are the symptoms if somebody has atrial fibrillation?
The heart is typically fast and irregular.
So can the person feel it? Can they feel their heart boop, 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 getting irregular?
They may have a sense of palpitations, heart racing, palpitations, irregularity, lots of symptoms, although not everyone realizes they have atrial fibrillation.
When you take your pulse, like you showed us how to do, what does the pulse feel like sometimes, or when you're feeling the pulse up in the neck? Carefully.
It's very irregular. The pulse is irregular. If you collected that pulse for 10 seconds, you could not repeat that cadence.
So you mentioned that it could be with an electrocardiogram.
Yes.
That you can find a normal time and it doesn't look like a sick sinus syndrome, but you have to record that for a period of time. What's that called? What do you do?
So for 24-hour monitoring, it's called a Holter monitor.
Holter monitor.
Yeah, so we collect every single heartbeat for 24 hours or 48 hours.
So you have to sit on the electrocardiogram table for 24 hours?
Nope, normal activities other than swimming in a pool or something, but basically normal activities, because we'd like to see over 24 hours what is the average heart rate, what's the high heart rate, what's the low heart rate, were there any arrhythmias?
And you can tell that when you take the Holter. What's the Holter monitor look like?
Well, it kind of looks like an EKG with leads that are attached to the skin, and then it has a little device that clips on the belt.
And so that device is like the black recorder in an airplane. It gets all the information that
Yes.
you can pull out, and then you can read it, and you can find out if the patient has problems during that 24 hours.
That's right. So we get to see every heartbeat for that period of time, 24 or 48 hours.
So what usually happens is when you come to the doctor or when you come to the mechanic, the squeak goes away and the heart rhythm goes. Is there ways to count the heartbeat longer than 24 hours?
Yes. If we give somebody an event recorder, so an event recorder, instead of collecting every single heartbeat, we apply that to the person. They get to keep it for 30 days. They take it off and put it back on, but they keep it for 30 days. And that way, during that period of time, if they ever have an episode, they press the record button.
So this would be somebody that says, boy, my heart just races sometimes, and you didn't find it on a Holter monitor. Event recorder. Now, when you push the button, how long does it take the electrocardiogram?
About 1 minute, typically, about a minute's worth of electrical activity.
So if you find somebody that's got a sick sinus, that's a big time problem. How do you get the sinus healthy? What do you do?
Well, we want to make sure that the person is not on medication that might be aggravating. Like beta blockers.
So beta blockers can aggravate the sinus and make it sick.
That's right.
Or not work right.
And that's probably the most important one. But there are other medications that can also affect the sinus node. So we look for that list of medications and see if that's affecting them.
And more we're getting different medications, so you have to really keep up to date on what can affect the heart like that.
Correct.
So if the medications are clean, then what do you do?
So we would evaluate the person. If we're suspicious of sick sinus and arrhythmias, an EKG, probably a Holter, and if that didn't find the information, then we would do an event recorder or event monitor for 30 days.
So then you find it, and you find the problem, and you find that they're either getting tachybrady,
Right.
or if they're getting a real low heart rate, or sometimes it even stops for a period of time.
That's right.
That's scary to me. So when you find that, what's going to be the next step? What are you going to do for the patient?
If there are fast arrhythmias like atrial fibrillation, where the heart's beating too fast, we may prescribe medications that help with the heart rhythm. We also may prescribe blood thinners because that helps to prevent blood clots and prevent stroke. If the heart's going too slowly, they might need something like a pacemaker.
So a pacemaker would speed up the heart rate. The other medicines would slow down the atrial fibrillation. Here's a question that popped into my head. Is it the SA node that triggers off atrial fib in people?
Well, a sick SA node, I think, makes them more likely to have atrial fibrillation, that tachybrady or fast-slow syndrome.
So when that happens and you're going to, if it's too slow, you put in a pacemaker. What's a pacemaker like? Tell me what you do now to get people healthy.
Certainly. So a pacemaker is wonderful. It's gotten to be very small. I brought one. So the pacemaker is a bit larger than a quarter or maybe a $50. It's inserted under the skin, and then it has a cable or a lead that goes through the blood vessel to the heart. And the lead goes into the heart muscle. And a pacemaker ensures that the heart never goes too slowly. For example, a pacemaker we could set at a rate of 60, 1 beat per second.
And so if it gets below that, it comes on or it stays at 60 no matter what.
Right, so it will never let the heart rate go below 60, a properly functioning pacemaker.
So if you've got a tachybrady, what do you do with that?
So they would typically get medications for the fast rhythm, the atrial fibrillation, and then a pacemaker for the slow heart rates.
Now they've got some new advances in pacemakers?
We do. So this would be called a single lead or single chamber pacemaker for the lower chamber.
So that's going to go in through blood vessels to a lower chamber.
Correct. And we have dual chamber pacemakers for the upper and the lower chamber.
Why do you want upper and lower?
To keep the organized electricity, upper, lower, upper, lower.
So the upper throws it into the big pump, the lower, and then the big pump sends it out to the body or the lungs.
Yes.
So what does that look like?
So this is a dual chamber pacemaker or a 2-lead pacemaker where this lead goes in the upper chamber of the heart, and then this lead goes into the lower chamber of the heart.
How difficult is it to put in a pacemaker? I see people all the time have pacemakers.
They do, and in fact, even the elderly patients, patients in their 80s, 90s, 100 years old, we would still put in a pacemaker if that person is walking and doing their activities at home.
Now you've got two other devices we want to show here.
We do. The most recent pacemaker is called a leadless pacemaker, which you can see is very small.
So on this one, you don't have any wires.
Correct. This one has no wires. It's with a catheter procedure. It's implanted in the heart. That's good for 10 years. It functions on its own.
And then when it finally tires out, you can put another one in, or you just see what you need to do at that time.
Correct.
And what's the other device that you have?
The final one is also a small device, like the 30-day monitor. This will monitor patients for up to 3 years. It's inserted under the skin on your chest wall over the heart, and it monitors the heart for the next 3 years.
So it tells the doctor, how do you get that information? It sends it through a phone, through a cell phone, vibrations?
We do. Yes, basically it interrogates and sends the information via cell phone.
You cardiologists are amazing. It's just, there's so many advances that are going on, and it all is made where people are able to live a more functional life and live longer and longer. In 30 seconds, how do you prevent the SA node from getting sick? Healthy lifestyle?
Yes. So it's risk factors. We eat healthy, avoid things that would aggravate the heart, like a high sodium diet, too much alcohol, too much caffeine.
No smoking.
No smoking.
So exercise, eat right, have a lot of
Yes.
laughter in your life, take that stress away. Malcolm Foster, I can't tell you how great you are as a teacher to help us know what's going on in the world of cardiology. Thank you for being so ahead of the curve and coming to teach people on the Dr. Bob Show.
Thank you, Dr. Bob.
A lot of information, brand new, and it will help you and me if we get a sick SA node or something else goes wrong with the heart. There's something that can be done to help you and me. Now you'll want to stay tuned. We're going to talk about a cough. Can a cough actually be good for you? And the dangers of too many NSAIDs, that's ibuprofen. It can cause a lot of problems. You'll want to stay tuned. I want to thank Dr. Malcolm Foster. Wonderful discussion on sick sinus syndrome of the heart. And now questions from you, the viewer, that I think will be important. First one's a cute question. Dr. Bob, everyone I know has a cough, and now I've got it. What's the cause? What can I do for it? How dangerous is it? Well, a cough can be good because It helps clear the chest. So if we're breathing in some particulate matter, it helps us cough it out. If we've got a little cold with some little bit of mucus in the chest, it helps us get that mucus out so it won't stay down in the bottom of the lungs and develop into pneumonia. However, if somebody has a cough that lasts longer than 3 weeks or even goes to 6 weeks, that's a chronic cough. And we need to know what's causing that cough. In young children, the most common cause of a chronic cough would be underlying asthma, where they've got a repetitive cough that's high-pitched and they may not even hear the wheezing. So young people, think of the possibility of asthma. There are some other things that always make a cough worse. Number one is postnasal drainage. So if somebody has sinus issues, stuffy nose, sniffles, congestion, and drainage, there's an area in the back of the nose, the nasopharynx, that has some receptors that says cough. And that cough will be there to help clear the chest if there's any mucus that begins to accumulate there. Now, coming down from the sinuses is one way, but coming up from reflux is another way. Reflux, when we eat food, the acid can actually come back up into the esophagus. So it can come all the way back up to the throat, go into the lungs, where it causes inflammation and cough. Or it can go halfway up the esophagus, where it sends a message to the lungs to cough. So we've got drainage, we've got reflux. Medications, common cause of cough. The most common cause is an ACE inhibitor, a blood pressure medicine. It's the most common cause of dry, relentless cough. When people have postnasal drainage and sinus issues, if they've got a blocked, infected sinus, that also sends a message to the mid part of the brain that says cough. So now we've got several causes. If you're smoking cigarettes, stop it. But it's the most common cause of dry, wet, rattling cough. We call it a smoker's cough or a death rattle. All of those are because you're smoking too much. If you laugh and you hear that raspiness in your chest, that cough, you know that the cigarettes are damaging your lungs. Please stop that. You don't want to get cancer. You don't want to get chronic bronchitis. You don't want to get emphysema. If we still haven't found the cause, then we need to get a chest x-ray. We need to look for a reason that somebody is having that cough. Questions? Next question, Dr. Bob. I've heard that ibuprofen can be dangerous. Well, ibuprofen is a great medication. What it does, it takes care of inflammation. Tylenol takes care of pain. There is no free lunch on any medicines, but the ibuprofen family does 2 or 3 things. Number one, almost every time somebody comes into the office with high blood pressure, the doctor will say, let's list your medicines. Ibuprofen on a regular usage will be what that person is doing. So it can affect the kidneys and it can cause high blood pressure. It increases heart events where people will start getting damage to the vessels that supply the heart, or their blood pressure goes up and it puts stress on the heart. So know that NSAIDs can cause damage. The ones we think of are ibuprofen, meloxicam. There are other NSAIDs that can cause the same thing. So if you've got high blood pressure, think about the NSAIDs. If you're taking NSAIDs, ibuprofen medicines, it increases the incidence of GI bleeding also. It irritates the stomach something fierce. It causes gastritis, red, hot, inflamed, and you can even get little ulcerations in the stomach, and that can even lead to GI stomach bleeding that people have. So know that the NSAIDs can be very, very dangerous. If you're taking them on a regular basis because you've got pain in your joints and your doctor doesn't know about it, be sure that you pay attention to your blood pressure, to a gnawing sensation in the middle of the abdomen, because that's a sign that the ibuprofen may be causing problems. What can you do about that? Well, you can, with the ibuprofen, you can take antacids. You can take medications to stop the heartburn, acid indigestion. But the best thing is to not take them every day. Talk to your doctor about why you're taking it for what pain and see if you can substitute that. If you can get away from long-term use of NSAIDs, you'll do better. That's all the time that we have this show. I hope you've enjoyed it as much as I have. Remember, you've got to be exercising. Exercising on a continual basis. You can get Fitbits, you can get watches, your iPhone can tell you how much you're actually exercising, how many steps. But it's that regular 20 to 30 minutes of regular activity that's going to do the best for your heart. It will reduce pressure, it will reduce stress, it will lower your blood pressure. It gets rid of some extra sodium in the body. And so exercise, it's really good for you. Be sure that you're eating properly. You know, we're learning more and more about nutrition. And we're learning different things every day, from low carbohydrates to low fats to low calories. Be sure you're eating properly. Eat good food. Eat less volumes. Eat a breakfast. Eat lunch. Eat supper. And when you eat, be sure that you're looking and you know what good foods are. No fried, fatty, greasy foods. Eat those good foods and they'll help you stay healthier. 7.5 to 8 hours of sleep every night. If you're not sleeping well, talk to your doctor about why. There's lots of things that can keep us from sleeping properly. Know what time you go to bed. Try to do it the same time every night. Know what time you wake up. And then you get the sleep that you should have. And most of all, if you've had those three, it's laughter that we like. The laughter in your life is going to keep you healthier, going to keep you happier, and you'll live longer.